Can you imagine how one of these 6 students must have felt on their first day? Look at their faces, their look of fear. As the field of cardiac surgery continues to push the limits of medicine, there's a lot to be learned in a short amount of time and can be a great experience. This presentation is geared toward helping you get initially acclimated to the unit. These are the cardiac surgery intensivists and surgeons. Their phone numbers are available in your packets. When you need to relay more urgent, important information, the paging system is recommended because it is part of the hospital record. The intensivist is first in your chain of command. Please alert the surgeon immediately if there are any surgical concerns. Sign up from the overnight provider is at 6:30 a.m. Don't be late! For continuity of care, it is suggested that you follow your same patient unless there is a particular case of interest to you or you wish to gain experience with a particular patient whose complexity is unknown to you. Examine your patients and obtain overnight information from your bedside nurse. Do this prior to gathering data and writing your notes. It is more important to know your patients for rounds. Data can be written down on paper. You should not rely upon the computer for data retrieval. Having to read from a computer screen is not respected and actually looked down upon by your attendings. The morning round team is multidisciplinary and consists of the following members. Prior to starting rounds, duties and tasks are divided among the team members and announced so everyone is clear. One person places orders in the computer and enters morning labs and chest x-ray on each patient. One person pulls up chest x-ray and pages for consults. One person fills out and reads back the yellow daily goal sheet for each patient. This ensures the opportunity for each team member to understand what the daily goals are for each patient. Whomever is presenting will pass their duties temporarily on to the next provider. The bedside nurse must be present for rounds, no substitutions. If he or she is unable to be present, we will skip that patient and come back. Remember, if the nurse doesn't know the plan, then it won't get done. Rounds are to be taken seriously. We are in a hospital dealing with very sick people. Side conversations, texting, reading emails, or writing your daily notes while someone is presenting is a no-no. It is important that each team member pays attention to each patient's plan. Staff around us must be quiet during this time. Interruptions during rounds should be kept to a minimum. It is distracting and someone might miss something important that was said. Nursing may use the post-it note system for simple non-emergent orders or relaying information. Oh yeah, social skills are key to survival in any ICU setting. Learning and referring to patients, family members, and staff by his or her name will show that you acknowledge and respect them as individuals. Remember that we are all of equal importance. Be a team player. Don't always wait for someone else to do something. Volunteer yourself. That will be noticed. Offer to help with tasks and procedures, placing lines, pulling intra-aortic balloon pumps, pulling chest tubes, entering case orders, even if it is not your assigned patient. Do not go hide in a corner or back in the conference room. That will also be noticed. Before you go home, ask if daily tasks have been completed. There are certain orders that can be done prior to patient arrival to the cardiac surgery ICU. When cases usually arrive, which is in the afternoon, the easiest thing to do is to grab a computer and go to the bedside. The post-op ICU arrival orders are located in Cerner, in the cardiac surgery care set. The nurse practitioner will in-service you on this. Orders to be done immediately upon arrival include a level 1 chest x-ray to evaluate ET2 placement and bleeding, post-op antibiotics, which usually include Vanco or Ancef, the drips the patient is on, and an arrival note. During the post-op period, stay at the bedside and review vitals frequently. Watch for adverse events such as tamponade, right ventricular failure, bypass graft down, etc. Fast-track extubation is the goal on all our patients if no intra-op or immediate post-op issues arise. Become familiar with the core and skip measures. Patient transfer and handoff. This is a big deal! The floor nurse practitioner or night intern needs to be called as soon as the patient has an assigned bed. Before your patient transfers to the floor, orders need to be cleaned up, medical reconciliation done, and ensure that morning labs and chest x-rays have been ordered. Clear communication with your fellow residents, attending physicians, surgeons, nurse practitioners, and nurses will lessen room for potential errors and broaden overall cohesion in the workplace. Do not assume someone knows what you're talking about, what you are thinking, or that the information has been correctly signed off or passed down to them. Around 3 p.m., everyone should do a walkthrough, stopping at each patient's room to review and evaluate the plan from the yellow sheet, assuring that the patient is within blood pressure goal, the status of the pressors, their fluid balance, sedation and the weaning of sedation, the status of extubation, if central lines have been discontinued, if Foley catheter has been discontinued, and if any medications have been stopped or started. Thank you for listening and being a part of the CSICU team. We hope your rotation is enjoyable and knowledge-filled.